And anything you want out of the house.
What you need to know before you make a homemade mask. Stay-at-home orders are shutting down a rite of passage for many college students. Now, many are left wondering whether they'll graduate. We're all being told to wash our hands a lot these days, but what is it about soap that makes it so effective against the coronavirus?
The next couple of weeks are going to be extremely difficult for the St. Louis region.
Medical professionals have a warning. These next few weeks are going to be rough. We're expected to hit our peak in the next 2 to 3 weeks. Today we learned St. Louis County passed the 1,000 mark with its number of cases, 1,033. The number of hospitalizations, people in the ICU, and patients on ventilators are also going up. Every day, we're bringing you the latest number of cases in our area. This gives you an idea of how fast the numbers are growing. In Illinois, there are now more than 12,000 cases and 307 deaths. On the Missouri side, there are more than 2,700 cases and 48 deaths. Good afternoon. Thank you for joining us. I'm Art Holliday. It's a new week, but the same news setup here at 5 on your side.
That's right. I'm Kay Quinn. I'm still working from home. Hello, Art. Good afternoon, Scott. And Scott and I will continue to do this in the coming weeks as we continue to social distance. Art?
Thank you, Kay. Well, like every day, things are constantly changing. We have a lot to talk about this hour. Now that the CDC is recommending you wear a mask in public, we'll explain how you can make your own. We're also breaking down some new unemployment guidelines and numbers, and how COVID-19 is impacting our local schools and students.
Missouri is officially under a stay-at-home order. That started at midnight. Illinois, the city of St. Louis, St. Louis County, St. Charles, and Jefferson County already had one in place. Of course, this means you can't leave your home unless absolutely necessary. But this latest order also puts restrictions on how many people can be in a store at one time. This is all in place through April 24th. Of course, some of those essential businesses are grocery stores and pharmacies. The CDC now recommending that everyone wear a cloth face mask when going out in public. But with so many tutorials online on how to make them, what are the best guidelines to follow? Our Tracy Hinson has been working on that story today. She joins us now with the tips. Tracy?
Okay, I'm outside of Schnucks here, just right off of Clayton, and a lot of people have been using masks, even their employees. Everyone has a mask, whether or not they're homemade like mine, or they're one of the paper masks. But I am not a seamstress, but my cousin Sandy actually made these masks for us weeks ago when the COVID-19 threat just started getting underway in the Bay Area. And luckily enough for me, Sandy followed the CDC guidelines when she made her masks.
I ran out of t-shirts.
My cousin Sandy and many like her across the country have dusted off their sewing machines.
I used to quilt. Okay. So I've made lots of, at least 5 quilts in my lifetime.
But she's since traded in quilting for mask making.
You sew the top together, you sew the bottom together.
But will Sandy's mask actually help me combat COVID-19? I asked St. Louis University's Dr. Michael Lim.
I think the way that you have your handmade mask with the loops that go around the ears, I think that's also perfect because it's easy to put on. Look, anything in the face region of that mask is the same thing as touching your face. And so we don't want to touch that. So we only want to handle that mask by the loops.
The same rule of thumb applies to those no-sew masks the CDC has tutorials for.
Have a couple, 2 or 3 layers within that mask, and there's enough layers of a nice cloth material that will protect from you aerosolizing a virus out to others.
And how should we be wearing these homemade masks?
Just kind of having it not totally loose, but sort of up against your nose and up against your cheeks, but comfortable, I think would be effective.
Wearing a cloth covering will help slow the spread of COVID-19, and it may prevent a person from catching the virus, but it is not a ticket to hang out with our friends again.
Look, the mask is not necessarily giving you a free pass to do everything and anything you want out of the house. Unfortunately, the concept now is social distancing, which means limit your time out of your own house and limit your time in communication with other folks. It's hard. It's not fun in any way, shape, or form, but that is actually the best that every person around here can do to try to stop that spread.
Now, Kay, it's also very important that people still reserve those medical grade masks for our medical professionals, doctors, nurses like my mom, because they will be handling patients and being in close contact with those patients with confirmed COVID-19 cases. In Clayton, Tracy Hinson, 5 on your side.
All right, thank you, Tracy. Now to some developing news out of St. Charles. More than 15 staff members and 3 patients have tested positive for COVID-19 at Centerpoint Hospital. The hospital treats psychiatric patients. It's now working with the St. Charles Health Department to notify people who may have been exposed. The hospital is also not allowing admissions right now. There's a new COVID-19 testing site in North St. Louis. It's in the Wells Goodfellow neighborhood on Dr. Martin Luther King Drive. You do need an appointment. Make sure you call CARE STL beforehand if you feel sick. The number is 314-367-5820.
Right now is a hard time for everyone, especially those who have lost jobs because of the pandemic. The U.S. Department of Labor has some new guidelines that could give some people extra money. It's part of the CARES Act, the $2 trillion bill that was passed last week. Under the act, eligible people can get a $600 weekly payment even if they receive other unemployment benefits. This includes former service members or people who are self-employed. You can find a full list and more details on KSDK.com. Last week, we told you how a record 6 million people filed for unemployment the last week of March. Here's how those numbers looked each week from the end of February to the end of March. The numbers doubled the last week of the month. In Missouri alone, more than 42,000 filed unemployment claims that week. That's a 962% increase compared to the week before. The hospitality sector is laying off workers by the thousands. Industries such as healthcare, senior care, and IT services are still hiring. The U.S. lost more than 700,000 jobs last month. Unemployment rose to 4.4%, and that number is expected to grow. The Federal Reserve predicts an unemployment rate of 32%. To give you an idea of how high that is, it's about 8% higher than during the Great Depression. We want to hear from you. Has COVID-19 affected your job status? Are you still working fewer hours, unemployed, or have you found a new job? Head to the 5 on Your Side app and weigh in.
We're following breaking news overseas. The British Prime Minister is in intensive care. Boris Johnson was diagnosed with COVID-19 on March 26, just over a week ago. A spokesman says his condition is now much worse, but we're told he is not on a ventilator.
Coming up, other people struggling during the pandemic, college students, the hurdles they're facing to find internships they need to graduate. Plus, the unique way a local school district is giving back to our healthcare workers.
And that warm front has moved north of St. Louis, and temperatures are now back into the 70s with a little bit of sunshine. We'll talk about a couple of warm days coming up.